So this may be a refresher for those of us that are already doing integrative and comprehensive approaches to treating women, especially with menstrual irregularities, menopause, infertility. But it can also be a good reminder that when a case is stagnant or it seems really tough or complicated, to go back and think about gut health. For those of you who are getting curious about integrative modalities in women's health, this is just the tip of the iceberg, and hopefully it will be a nice introduction to the amazing presentations that IHS has to offer. So Julia Enders is a German microbiologist, and she wrote a best-selling book, The Gut, the inside story of our body's most underrated organ. And her quote, "Every day we live and every meal we eat, we influence the great microbial organ inside us for better or for worse." I think that this is a perfect representation of what my talk is going to be about, because it's really that empowerment, that just because we were born a certain way or we have a genetic makeup, that we can do a lot to influence how our health trajectory goes. So our gut microbiota, what is it? So this is a virtual organ composed of trillions of microorganisms, including bacteria, viruses, fungi, archaea. And the gut is the main location of the human microbiota. We know that we have a skin microbiome, a vaginal microbiome, but the gut is the main place for our microorganisms. There's roughly 40 trillion bacterial cells and only 30 trillion human cells in the body, which is just fascinating. And it acts as an endocrine organ itself and a second brain. Here is a nice schematic of all of the parts that make up our microbiome. And then as well, we'll talk about our metabolome, which is the metabolites that our microbiome makes, signaling molecules, toxins, and organic molecules. So we talked about, how many bacteria or microbiome organs are in the gut microbiota. But they encode 3.3 million genes, which vastly outnumbers our approximately 23,000 genes in our human genome. And so this is really, again, where integrative medicine thrives, in the ability to understand that our genes don't make or break us. We have so much influence with lifestyle and other interventions, and so focusing on gut health and what we can do to impact our microbiome is going to go a long way for treating chronic diseases and prevention. So diversity and balance are markers of a healthy microbiome. We have diversity that impacts hormone production, which we'll learn about, metabolism, and signaling. We talk about the microbiome and how it communicates via the gut-brain axis to modulate the hypothalamic pituitary ovarian axis. And this is really what I try to educate my patients on when they don't understand, well, why are you treating the gut? I have, I'm not ovulating, I'm having infertility issues, my perimenopause is out of control. And so that understanding that inflammation in the gut can drive imbalances in our reproductive organs. And so much work done in the gut really has a huge ripple effect for treating women. The gut's influence extends to various stages of women's reproductive journey. We'll see that our gut microbiome can vary with diagnoses like PCOS, pregnancy, and menopause. And then specific microbes like lactobacillus regulate estrogen metabolism through the estrobolome. So these are all of the amazing things that our gut microbiome functions for us, absorbing minerals, synthesizing essential vitamins. We know that many gut microbiome can make B vitamins, B1, B2, B6, B12. Talked about vitamin K, regulating gut motility, providing short-chain fatty acids to our enterocytes as quote-unquote food. We have neurotransmitter production, the synthesis of serotonin, GABA, dopamine, regulates our hormones, which we'll get into more, involved in the breakdown of estrogens via the estrobolome, and transforming bile acids and steroids, among many other things. So factors that influence the gut microbiome, from childhood, lifestyle, food, environment. We see that, for instance, babies born via C-section do have higher rates of asthma and allergies. We know that exposure to the vaginal microbiome improves a infants and newborns' gut microbiome. Lifestyle, poor sleep. We know that if you're not sleeping well, your gut microbiome are on a circadian rhythm, just like you. And so that can drive dysbiosis. It can drive increased cortisol levels, which we then know have impacts for so many far-reaching symptoms in our body, and such things like cortisol regulating ghrelin, leptin levels, and obesity, overweight, those types of complications that can be impacted when we disrupt the gut microbiome. The gut's role in multi-system regulation is, like I said, far-reaching. We know that there is a gut-brain axis, a gut-ovarian axis, gut-bladder axis, and so we'll touch on some of these important multi-system regulations. This is a diagram of eubiosis. So in a perfect circumstance, we have a microbiome that is providing short-chain fatty acids, antioxidant production, reducing gut inflammation, making vitamins, improving body fat deposition. Our body is in homeostasis. And that's really what the gut microbiome is looking to do. They are bacteria that really are focused on their ability to propagate, and so they want to reduce inflammation. They want to remove any concerning host that may be competing for what they are trying to do. So we work in symbiosis with bacteria and viruses and fungi in our gut all the time. So our gut-brain axis is one of the ones that we're going to touch on. Is this working? Can you guys hear me okay? Okay. So we know that there's long-distance communication that happens with our gut and our brain. We have microbiota-derived compounds that are transported through the vagus nerve to the brain. We see a lot of circulatory system passage of these metabolites as well. And we know that the gut microbiome, as discussed, can synthesize several neurotransmitters, including serotonin, GABA, and dopamine. So again, for what I do, anxiety, depression, mood disorders related to perimenopause and menopause, PTSD related to infertility. Again, so many of these still require a focus on the gut health and the gut microbiome. Our gut-vagina axis. So fascinating to know that the administration of either oral or vaginal probiotics for vaginal health can improve both vaginal and gut health as well through a bidirectional approach. And then we also have crosstalk between the gut, the urinary tract, and the genital tract. We know that for women's health practitioners, me as an OBGYN, if someone is complaining of chronic UTIs, we're thinking about what's going on in their gut, what's going on with their vaginal microbiome, and not solely focusing on the bladder. This is a breakdown of the beautiful Metabolome products that are a result of diet, influence, and how the gut microbiota then go on to make their metabolites. So short-chain fatty acids like butyrates, microbial tryptophan catabolites, TMAO. We have our secondary bile acids formed from primary bile acids and the gut microbiome. And then the gut microbiome directly can make branched-chain amino acids. That's valine, leucine, isoleucine, polyamines like spermidine, and bacterial vitamins. So the microbiome hormone connection. So interacting with estrogen, androgens, insulin, and other hormones shape disease susceptibility, and we see it all the time when we're taking care of women in the integrative space. We see a bidirectional relationship. As discussed, we have bacteria that want environments that are going to be beneficial to them, but at the same time, that creates an environment that is beneficial for us. We see that there is a sex-specific pattern that happens. We'll talk about the microgenderome between men and women. And the gut microbiome hormone connection can influence the inflammatory state via lipopolysaccharides, the gut barrier, and several of its metabolites, especially short-chain fatty acids. And of course, this is for better or for worse, as we see reductions in estrogen, progesterone levels during perimenopause and menopause. We will see increased inflammation in the gut, which will then, again, drive a bidirectional type of overflow for impacting not only the gut bacteria, but our overall health. Our hormone connection also modulates gut barrier integrity, reduced inflammation, balances hormonal disruptions, and oxidative stress. So estrogen and progesterone status matters when it comes to gut health, and then obviously also how we interact as far as symptoms go. So we see that women, of course, as menopause approaches, our estrogen and progesterone levels, as well as testosterone declines. Men have a steady state of testosterone for the majority of their lives. And the estrogen and progesterone decline have an impact from head to toe. We see, anxiety, depression, mood disorders, and then to toe, we see increases in shoe size and increased risk of bone fractures from osteoporosis and everything in between, with hot flashes, increased risk for cardiovascular disease, weight gain, vision changes, tinnitus symptoms, heart palpitations, and so on. So sex differences in the gut microbiota that we talked about. Males show reduced diversity and higher Enterobacterialis abundance compared to females who exhibit greater diversity. And we see that diversity really peak in females during adolescence and adulthood. Eggerichella prevalence has been linked to early ovarian failure, something that you can see on your GI map, and so I do make sure that we're addressing this with patients when they get those types of results. Akkermansia as well, we can see on studies like GI maps, and we know its importance in weight control and how it has an interplay with estradiol levels. We see that fecal microbiota transplants from males to females increase testosterone levels, demonstrating that bidirectional regulation. And then fascinating to know that some species like Clostridium and Ruminococcus are able to synthesize androgens themselves. So our microgenderome here, where's my laser? So we're seeing what's going in, what we're feeding our body, probiotics, prebiotics, symbiotics, and then our healthy microbiota in our gut. Dysbiosis can cause immune activation and inflammation. And then we've got our sex hormones and how they're balancing our gut microbiome as far as inflammation, adiposity, and immune system health. So the microgenderome, we have a hormonal influence on microbiota. Estrogen, progesterone, and androgens modulate gut microbiota. We know that estradiol promotes lactobacillus growth. We know that progesterone helps with reducing leaky gut, improving intestinal lining function. It helps to slow digestion down, and progesterone has impacts on the immune system function in our gut. We see the effects of microbial gene expression and metabolic activity altering the intestinal milieu. And then gut microbiome, gut bacteria metabolize sex hormones. We'll talk about beta-glucuronidase and the pros and cons of having that abundantly to deconjugate our estrogens, which influence its bioavailability. As we talked, we know the microgenome can influence reproductive health, immune response, and disease susceptibility. We talk about estrogen decline associated with insulin resistance, increased inflammation. Dysbiosis contributes to differences in disease prevalence between sexes. We know that autoimmune disorders and cardiovascular disease rates are higher in women. And so important and really far-reaching ability to reduce these comes from focusing on gut health or incorporating it into the interventions that you're doing to reduce those risks or to treat those diseases. So introduction to the estrobolome. These are the enteric bacterial genes involved in estrogen metabolism. So we know that with estrogen metabolism, we have phase 1 and phase 2 metabolism, and in phase 2, estrogen can be conjugated with our sulfates and through glucuronidation. It then gets excreted into bile and feces, but we do have some bacteria that encode an enzyme called beta-glucuronidase, which hydrolyzes glucuronides, liberating the free estrogens for systemic absorption. We see that beta-glucuronidase activity can increase with high-fat protein diets and decrease with high-fiber diets. And again, you know, it's not necessarily if it's a good thing or a bad thing, is this a good thing or a bad thing for you in your current situation with your current diagnosis? We have here, this is, and so speaking to that, whether it's a good thing or a bad thing, we have our low estrogen states, obesity, metabolic syndrome, cognitive decline. Those may be opportunities to manipulate beta-glucuronidase bacteria. And then our high estrogen states, same thing, endometriosis, estrogen-driven cancers. So where are we finding that balance for estrogen metabolism that is most optimal for that individual patient? In our reproductive tract, we have the estrobolome. We talked about estrogen supports lactobacillus dominance, maintaining that vaginal pH and epithelial integrity, which is crucial for so many aspects of women's health. We know that a healthy vaginal microbiome and estrobolome can regulate menstrual cycles, reduce the risk of endometriosis progression, impact PCOS trajectory, influence fertility, as well as pregnancy outcomes. So post-menopause estrogen decline, we know that those shifts impact our gut microbiota. We see inflammation that develops as a result of reductions in estrogen, and the gut microbiota can be impacted by this, causing more inflammation, insulin resistance, and dysbiosis. Modulating our gut microbiota can help us counteract menopausal health risks through improved estrogen production. When we have an unbalanced estrobolome, we know that so many aspects of women's health depends on that balance of estrogen. We have impacts for our gut-brain axis, our gut endocrine axis. If we have more circulating estrogen and a high level of beta-glucuronidase activity, then we're seeing those high estrogen symptoms, irregular periods, heavier periods, PMS symptoms, endometriosis risk, PCOS symptoms, and then that low beta-glucuronidase activity where we're seeing low estrogen symptoms, weight gain, menopause, perimenopause, early menopause, infertility. And then our vaginal microbiome, which again really relies on estrogen for the production of glycogen, which then has an impact on improving lactobacillus species dominance. This I touched on before, just fascinating to see the differences in the gut microbiome with different diagnoses for females. For instance, we see for a healthy female gut, we have lower Bacteroides abundance, but higher diversity than males. Menopause, we see less diversity, cervical cancer in the gut microbiome, marked differences in our alpha and beta diversity, increased proteobacteria. Endometriosis, we see increases of streptococcus, staphylococcus, and then PCOS, we see ratio of Escherichia and Shigella are increased. So this is a great slide for you to kind of try to take a look at your GI map or, any GI effects, anything else that you do for stool testing to see if you can start to get a better idea of how you can help to manipulate a woman's gut microbiome for positive changes if they have any of these diagnoses. This is our estrogen gut microbiome interaction, just a summary of the things that we discussed as far as the microbes that impact each of these disease processes. So many patients and obviously clinicians like us in the integrative space not only seek natural options for symptom relief, but I think why I went from just conventional medicine to integrative medicine was because I wanted to give patients more options, okay? So I think even if you're doing oral contraceptives, even if you're doing hormone replacement therapy, you still need to incorporate gut health in order to get an optimized treatment plan together that will be long-lasting for the patients. So these are some ingredients that we're going to go over that is in Metagenics' new product. Saffron, so I think we all love saffron. It's been around for over 3,000 years. And we see that saffron can act like an SSRI. It really helps to inhibit reuptake of dopamine and norepinephrine. Mood disorders are associated with elevated oxidative stress and a deficit of exogenous antioxidants. So this is, again, that gut-brain axis understanding that we do want to reduce inflammation in the gut because of that gut-brain axis, and we want to focus on anti-inflammatory, antioxidant-rich therapies for these patients. So saffron counteracts oxidative stress, which is amazing, and it also modulates our gut microbiota. Again, we see modulation of our HPA axis, helping to lower cortisol levels. We know that cortisol levels can drive inflammation. Studies also suggest that it can be used for PMS symptoms to improve irritability and depression. And we have seen studies that have shown saffron can help to alleviate menopausal symptoms like mood symptoms as well as hot flashes. This is just a study showing the improvements in depression scores in women using Affron, which is a standardized concentrated form of saffron. And then another ingredient in the new product that will be available is licorice. We, in the functional integrative space, use a lot of DGL for GI symptoms to help with leaky gut repair, to help with symptomatic reflux, ulcers. But we know that it has an antioxidant and an anti-inflammatory effect. And again, just thinking to those women health diagnoses, endometriosis, PCOS, perimenopause, menopause, infertility, that we know have underlying oxidative stress, antioxidant need, and inflammation. We see that it's really a safe supplement to use. It's effective, well tolerated. It's going to inhibit our COX and LOX pathways, reducing pro-inflammatory mediators, and decreasing that LPS-induced inflammatory response. It restores tight junctions and reduces inflammation. This is just an example of a study that was performed using Gut Guard, which is in many of the Metagenic supplements, 75 milligrams twice daily, which is the deglycerinated version of licorice, so safe for people with hypertension concerns, and significant decreases in symptoms as well as improvements in quality of life with these outcomes. Chromium, which is just, I think, an underrated supplement addition, has a huge role in insulin signaling, helps to reduce oxidative stress, helps to optimize cholesterol homeostasis through a lot of the work that it does with insulin. And then it shows, obviously, improved glycemic control and reduced insulin resistance. Chromium picolinate specifically, 200 micrograms per day, showed reduced fasting glucose and 2-hour glucose tests, fasting insulin, and hemoglobin A1C. Again, this is a great addition and very safe. I often use this with my pregnant patients who may be at risk of gestational diabetes or have been diagnosed with gestational diabetes. Vitamin D, which when do we not need or have an opportunity to use vitamin D? Such a major player in so many aspects of optimal health, but especially with gut health, it helps to maintain our intestinal barrier integrity by regulating tight junctions. It acts as a modulator of immune function, influencing both innate and adaptive immunity. It affects the composition of our gut microbiome, leading to more diversity. And then we have vitamin D receptors in our intestinal epithelium and in our immune cells. Small schematic of just how vitamin D, the active form, is produced from our skin to our kidneys, and then eventually helps to induce the expression of our antimicrobial peptides for immune system optimization. Probiotics, we love lactobacillus and bifidobacterium. We know that they're going to enhance gut health by restoring microbial balance, improving intestinal barrier integrity, and modulating our immune responses. They increase those short-chain fatty acids, which are important for our gut health, reducing inflammation, optimizing brain function. And then we have some probiotics that are really great at inhibiting pathogenic bacteria. We see that probiotics can also help with our immune system function by promoting IgA production and regulating our T helper cells. So this is the product that has all these great ingredients in it, which I was informed will be here at 11 o'clock. It's like a celebrity, I guess. And I'm very excited and anxious, can't wait to use this product for my patient clientele. But neuroprotective, mood stabilizing, it's got that saffron, sleep promoting, it's got some B6. We know that saffron can help with sleep as well. Gastroprotective, prokinetic with that gut guard, promotes healthy blood sugar metabolism with the chromium. Clinical applications, sleep quality improvements, digestive symptoms including abdominal pain, fullness, bloating, heartburn, can help to ease cravings and appetite. Okay, so I'm going to just review 2 case studies that I've had in my clinical practice. And by no means, I'm not a protocols provider. I love that that's the space that I'm in. And I think that all of us here are probably here because we got out of protocol medicine acting like we're robots and we only have 1 or 2 options to give every single patient. And most protocols are going to work most of the time for most patients, but in those instances that it doesn't work, it's nice to have variety. And also, it's unique to see a patient for their individual needs. So my first patient is a 57-year-old postmenopausal female. She was seeking health optimization after discontinuing tirzepatide. She had had a 20-pound weight loss after 6 months. She had a long-standing history of IBS, persistent symptoms. She had tried many gut repair plans with different providers in the past. She kind of always fell back into intermittent bloating, gas, diarrhea, constipation. She also has a history of hyperlipidemia, fairly newly diagnosed since being postmenopausal, psoriasis, osteopenia, sleep apnea, and then she had a history of unexplained infertility in the past. When I saw her, she, like I said, she was coming off of the tirzepatide, and the only other medication that she was on was an estring, which provides local vaginal estrogen. Key lab findings, we did find elevated cholesterol levels, elevations in her inflammatory markers, CRP, homocysteine. Her hormone profile for a 57-year-old who was only using local estrogen actually looked pretty good. So, I mean, when I think about it, a 57-year-old who has a good estradiol level for me in the functional range, I do think about that gut dysbiosis. What's her, the species that are producing beta-glucuronidase. So we did do a GI map, which showed dysbiosis, low akkermansia, leaky gut, and she had some significant markers for inflammation, intestinal hyperpermeability, and immune activation. Her diet, she said that she was 95% gluten-free, 90% dairy-free, but she had an erratic eating pattern, and that she was an emotional eater as well. She said that she strength trained twice weekly, asking her more about that. 5 to 10 pound weights is what she was doing for about 20 to 30 minutes, and no consistent cardio. Sleep, she was having midday fatigue despite 6 to 8 hours of sleep. And then caffeine 1 cup a day, alcohol 1 to 3 glasses per week. And the current supplements that she was on was vitamin D, omegas, and a biotin. So with these diagnoses, gut dysbiosis, irritable bowel, postmenopausal, metabolic dysfunction with hyperlipidemia, elevated inflammation markers, vitamin B and D deficiencies. I put 8-week elimination plan, but I don't love to say elimination protocol. I really do, talk to patients about, hey, let's crowd out. I work with a health coach and a nutritionist. Let's crowd out and try to reduce as many inflammatory foods as possible, not necessarily restricting if that's going to cause negative relationship with food, with your ability to interact with your family and friends. We talked about limiting cross-reactive foods since she was already 95% gluten-free, but it showed a lot of inflammation in her gut. We talked about anti-inflammatory dietary strategies, increasing our soluble fibers, introducing fermented foods, omega-3 rich foods, in the short interim, limiting red meat and processed foods to reduce systemic inflammation, and increased polyphenol-rich foods. Our lifestyle stress management plan, she talked about high stress, she talked about traveling frequently, an emotional eater. We know that vagal tone is important for helping to reduce cortisol, so really tried to get her to key into how much, she can't control her stressful situations, but how she reacted and managed her stress could go a long way to so many of her diagnoses. We talked about her physical activity, increasing her weights when she was doing resistance training. We talked about the importance of muscle building, which can help to reduce insulin, reduce inflammation, improve the gut microbiome. And then sleep hygiene. I did make sure that she went to see a sleep specialist. She had a sleep study done, which overall looked good. So we just talked about sleep hygiene. And then her hydration we talked about as well. I implemented a 5R protocol. Again, this is not something that I just print off and give to every single patient. I really try to produce a plan that is personalized to each patient. And nor do you have to do supplements for all of these. Some people get really overwhelmed by supplements. I do find that most people like starting with supplements while they're trying to figure out their nutrition, their lifestyle, and they can be more effective in the short term for symptom relief. So we did removal with Candibactin AR and BR. If you guys haven't used Candibactin AR and BR before, it's a game changer. I love it for SIBO. I love it for dysbiosis. Has a lot of great essential oils that act as antimicrobials. Replace, we used Spectrazyme, betaine HCl, a great digestive enzyme product from Metagenics. Many times with people with IBS, with inflammation, they do need that support with digestive enzymes. So even if I don't see low elastase on a GI map, I do find that digestive enzymes are really effective. Reinoculate, so important to bring back in healthy bacteria, reestablish a healthy gut microbiome, and Ultraflora Healthy Weights with Akkermansia was a great option for her as, again, she was transitioning off of that GLP-1 and she really wanted to optimize the weight that she had already lost. Repair, Glutagenics GI lining support is amazing, has I think 3.5 grams of glutamine in it. It's extremely powerful, works very effectively. And then their Zenlori is a zinc carnosine complex that is effective for leaky gut repair. Probioplex is immunoglobulins from whey protein. So many of the immunoglobulin options on the market are egg-based, and some people have egg allergies. So I like Probioplex. And then Rebalance, Ultra GI Replenish or GI Sustain. Those are great options for continuing to provide what our gut microbiome needs for continued support. And then Foundation Nutrition, making sure that she had optimal supplementation for that vitamin D and a good vitamin B complex now that she had reduced inflammation. She could actually absorb her B vitamins. And then my second case is an infertility patient, a 33-year-old female who came in with infertility for 2 years. She had a history of PCOS, which was associated with hirsutism, acne, dysmenorrhea, menorrhagia. She had done intrauterine insemination and IVF, both of which were unsuccessful, and she really didn't feel well on fertility hormones, and so wanted to kind of just take a break, find some root cause, and consider natural conception, or at least augmentation of some integrative approaches with fertility treatments if she were to go back to that. She had no laparoscopic signs. She had never had a diagnostic laparoscopy for endometriosis. But she had many of the symptoms, and we know that 5 to 10% of PCOS cases are associated with endometriosis. So I kept that in mind while treating her. And so for her, of course, we did a GI map analysis. I also, I'm big on toxin exposure with infertility. We know that things like mold toxins, BPA, heavy metals can impact fertility, and she did not prove me wrong. Her toxin exposure, she had many mycotoxins, some heavy metals, and then xenoestrogens, BPA, and 4-nonylphenol. And glyphosate as well. Her GI map showed dysbiosis. She had an overgrowth of those bacteria that we can see with endometriosis, and then low secretory IgA, and she had a borderline elastase. Her thyroid function was a little suboptimal. Metabolic and insulin resistance markers, insulin level I usually like 2 to 5, 2 to 7. Low sex hormone binding globulin, which we see often with PCOS patients, then a low ferritin. Her creatinine, for me, was a little bit low, so just talking about, muscle building, doing things that are going to support insulin sensitivity with strength training for her PCOS diagnosis. Of course, low vitamin D, and then some markers for adrenal dysfunction. So again, we started with gut health, which we always do. I think in those few cases where I've tried to treat infertility by just going straight to fixing ovulation, or I've tried to treat toxin exposure with going straight to detoxification, you're always going to be spinning your wheels, and you need to come back to treating the gut, which can solve most of those cases anyway. So we did a gut repair protocol with some digestive enzymes. We used glutagenics for GI lining support, and Indofin as well, which has some plantains, some great ingredients for improving that gut lining. We did omega support with omegagenics fish oil, obviously super important for preconception and conception, and that was something that she was able to continue on with pregnancy. And then we added Ultraflora Spectrum probiotic, which can be really helpful for detoxification as well. So she did that gut repair protocol along with interventions with the health coach, managing stress with her adrenal dysfunction. And then we also added Synetol. If you guys haven't used it, it's amazing. It has 4 grams of myo-inositol and magnesium as well. Really helpful for estrogen production, ovarian hormone balancing. And then toxin elimination supplements as well with UltraClear and GlutaClear. So we started her plan October of 2023. I asked her to hold on actively trying for pregnancy, especially while we were detoxifying. And then April 2024, we did her repeat toxin tests, which noted marked reduction in all her toxins, and she was cleared for actively trying. And she conceived a healthy baby in July 2024, all on her own. So these cases just, give me more fuel and energy to continue to practice medicine the way that I have been able to practice it, really finding that art of medicine again. And so I hope that you guys learned something from this presentation. Thank you for your time.